Okay. Here's where we left off on Wednesday. Okay. Here's where we left off. We were talking about resistance training. We were talking about those neural adaptations. Okay. Anybody on Wednesday do like one arm curls to make your other arm stronger in that way? Well, you guys mind, there's also evidence that if you exercise one side of your body and you put a mirror right here and you look in the mirror so it looks like right side exercise is making the left side exercise, it actually enhances the crossover effect. Your brain is a wonderful, crazy thing. Okay. But we left off about neural adaptation. Workout today, stronger tomorrow because of increases in recruitment, right? Maybe increases in firing rate, turning off the Golgi tendon, and the like. Okay. This is why people that are untrained get a lot stronger really, really fast. Okay. Neural adaptations. Okay. So, let's see if we can advance. Here are data. Okay. If anybody wants to do something like this, you can come to my lab and we will run a bunch of electricity into your leg. But here is a group that trained. This is knee extensors. They did knee extension for, I think, 12 weeks. Okay. And then they had a group that did nothing for 12 weeks and sat on the couch. And what you can see basically is the gray bars are before training, the white bars are after training. This is called, they're calling it voluntary activation. This is the percentage of the motor units in their knee extensors that they could recruit or activate or turn on before and after training. And so you will note they're at a little over 80%, right, when they started, and they're up much closer to, say, in the low 90s after training. This is the very typical thing that happens, okay? Motor unit recruitment increases. Motor unit recruitment increases. That's the big, kind of the big neural adaptation that occurs. Okay. I'll show a couple of other things that are going to demonstrate the specificity of neural adaptations. I told you guys on Wednesday, right? Specificity is whatever you want to get better at, that's how you have to train. And whatever you're doing in training, that is exactly, okay, through that range of motion, at that velocity, with that weight, that's what you will improve at. So what you see on the left, okay, these are very old data. I'm sure to you guys, they're actually after I was born, they're very old data. And what you can see is they had two groups of people. This is again in the knee extensors. One group trained at about 95 degrees per second. Okay, so relatively slow movement. Not super slow, but relatively slow. Okay, the group on the bottom trained at 240 degrees per second, which for many of you guys, if you're not running or something, is about as fast as you can go. Okay, they created then, this is a concentric torque velocity curve, right? So as we go faster, force should fall. As we go slower, force should be higher. And what you see is in the group that trained slowly, they got disproportionately stronger at slow velocities. They got a little bit stronger at fast velocities, but most of it was at slow. Okay. In the group that trained fast, they only got stronger going fast. They did not get stronger when they were going slow. Okay. And so this is one of those things. All right. If you see people that are athletes that are doing super slow training, I don't know any sports where the idea is to go as slow as you possibly can. Right. There's very few sports where that's the thing. Now, if you're a weightlifter, right, or a power lifter, and what you want to do is get as much force as possible, train slow is very, very reasonable because it maximizes force. But what this shows us in some ways is that to get better at going fast, we at least need to go reasonably fast. We need to go very, very fast. Okay? So velocity matters. On the right, okay, this shows the specificity of the type of contraction that we're doing. I mentioned again on Wednesday that if you're doing curls, right, when you do curls, you get way stronger doing a 1 rep max curl. So the most weight you can lift, you can actually move. Versus if I put your arm at 90 degrees of flexion and you do an isometric contraction right here. And that's what you see in the graph on the right. This is the percent increase in strength, right? And over 12 weeks, you'll see that isometric strength went up very little, maybe 15, maybe 20%. Whereas the weight that people were able to use when they were training, okay, went up more than 150%. So the neural adaptations are going to be very specific to velocity, to range of motion, to the type of exercise that you're actually doing. Okay? The type of exercise that you're actually doing. So they're very, very specific, right? So when you need to train, keep all of that in mind, right? What is it you're actually training to be able to do? And you should train as close to those muscles, that range of motion, that velocity, that movement as you possibly can. Okay? That's not always possible, right? But that's an ideal kind of way to get after things. Okay. This is going to show us a little bit of what's happening at the Golgi tendon. Kevin.
On that slide, the graph on the right, is that based on the training regimen, the only training in 1 rep max?
No, it is not. So that's I don't remember off the top of my head, but most of those studies are over 12 weeks, some combination of like 3 to 4 sets of like 6 to 10 at the kind of corresponding percentage of 1 rep max. With an adjustment, probably most of them are like every 3 or 4 weeks, they'll reassess 1 rep max and then adjust the percentage as people get stronger. So that's not training at max. That's a whole separate, I don't remember if I have data about that, but that's a really interesting question. There are people that advocate that if you want to get as strong as possible, all you should do is just go do 1 rep maxes, right? Just go train today and lift as much as you can and try that 3 or 4 or 5 times. Okay. So I don't know if I have a slide about that, but we'll revisit that. Miles. That basically answered it? Okay. Good questions, guys. Oh, wait, sorry. These are data demonstrating what we think is how Golgi tendon organs and their ability to essentially inhibit force is going to change over time. What you see on the top, this is increases in force in the quads, in the knee extensors, over an 8-week training regimen. What you see on the bottom is this is called an electromyogram. So it's electrodes, you put them on your hamstrings, right? And it measures those action potentials that are going through those axons and sarcolemmas in the hamstring. Okay. And so they're measuring the amount of activity in the hamstrings during knee extension. Okay. And so what you can see is that within the first week or so, we see a decrease in hamstring activation and then it stays down and it doesn't drop a whole lot more. There's some other evidence that it does go down a little bit farther. This was just the first study that saw this, that as you train your quads, one of the things that allows you to be stronger in your quads is that you have less what we call co-contraction of the hamstring. The antagonist gets shut down, which means more of the force from your quads gets applied across the knee to try to get knee extension. Okay, so this is demonstrating that turning off of the Golgi tendon, because we can't really go into your tendon and actually measure very much sort of how much stimulation we're getting there. We have to use kind of the output side of things. Okay, does that make sense, guys? Right. So as I squat and I use my quads and my glutes, I'm going to get better at relaxing my hamstrings while I'm doing the whole thing. Okay. Okay. There's just a summary of neural adaptations. Now let's talk about everybody's favorite thing. Okay. Let's talk about everybody's favorite. How big can you get? Okay. How big can you get? And so the other adaptations that take place with resistance training are what we call contractile protein adaptations. This is muscle hypertrophy. This is getting swole, whatever you want to, however you want to frame it. Okay. What we see with the contractile protein adaptation is an increase in actin and myosin. Okay, an increase in actin and myosin. As actin and myosin increase, right, you've got, I apologize, but you've got a muscle, and then inside there, right, you've got a fascicle, and then you've got in the fascicle, you've got a bunch of fibers, right, and then in those fibers are myofibrils and sarcomeres, etc. What happens is, to make the muscle get bigger, each one of these fibers gets bigger. So what eventually happens right then is that the muscle gets bigger because we add actin and myosin into each individual fiber. That fiber swells and gets bigger. As the fiber gets bigger, the fascicles get bigger. As the fascicles get bigger, the whole muscle gets bigger. Okay? So we say when you add actin and myosin, we are increasing the cross-sectional area of a muscle. More actin and myosin, more cross bridges, more force. Or so some people believe. There's a group that thinks that increase in size does not play any role or a very minimal role in the increase in strength with resistance training, which I think is a fabulous argument to make a grad student have, but also a little ridiculous, right? If we just look around to guess who's the strongest, it's probably the biggest person, okay? So what's the time course of this? Well, it takes about 6 to 8 weeks for us to see increases in muscle size that you can see with the naked eye, okay? That you can see with the naked eye. So we got a month, okay? We got about a month until spring break. It's too late, guys. It's too late to start now, okay? If you want bigger muscles before spring break, because you're going skiing and you need to be stronger, right? That's why we want bigger muscles. It's too late to start now, okay? You should have started a month ago, okay? It takes 6 to 8 weeks. Now, with high resolution imaging or taking biopsies and pulling fibers out, there is some evidence that we can see increases within 3 weeks to a month, okay? 3 weeks to a month. So it's happening. It's just not particularly sort of large enough that you can notice it with your eyes. Okay? So if you want all your TikTok followers to notice whatever you're doing, you got to give yourself 6 to 8 weeks. Okay? So plan out your content. All right. So now we get to the question of that everybody wants to know. If we ask your non-HES friends, how big can you get? Everybody, for the most part, that doesn't know anything, overestimates how big you can get, right? Because they see other people that are huge, right? Many of whom are taking steroids. Many of whom are just the far right-hand sort of tail on the normal distribution curve on those kinds of things, all right? The average person is likely going to see somewhere between 5 to about 40%, okay? Averaging between about 15 and 20% increase in muscle size, which is nothing to scoff at, right? That's real increases in size. It's noticeable, it's real, but it's just not, we're all gonna look like The Rock, right? Or whatever in 6 months or a year or whatever you want. You gotta take the steroids, okay? This is largely influenced by genetics. Genetics influence fiber number, which probably plays a role. Genetics influence your responsiveness to estrogen and testosterone and insulin-like growth factor, right? Genetics influence your resting levels of testosterone and estrogen and those hormones and those things. It is massively affected by steroids. There's about 2 studies that have ever been done giving people steroids. It's unethical for us to give you something that we know has potential health consequences, right? Especially if whatever we're giving it to you for is not in and of itself, right, a serious health concern. It's one thing to give somebody with stage 4 cancer an experimental drug that we don't know if it's going to work or not, or we don't fully appreciate what the side effects are, because if it works, the positives may outweigh the negatives, right? What if we do nothing? All of you guys are generally healthy. If I give all of you testosterone or synthetic testosterone or whatever, every one of you will get bigger. You don't need to do anything. Sit on your couch and eat Cheetos, right? And you will get fucking huge. Okay? If you take steroids and you resistance train, we're not sure what the upper limit is. You will get absolutely huge, absolutely jacked. Okay? There's only been a couple of studies. One of them was published in the 90s in the New England Journal of Medicine, which is the single best scientific journal in the world. And that's how we know if you take it and don't do anything, you're going to get bigger than what normal people will get without taking steroids and doing other things. Okay, Miles, I see you. We'll come there in a second. Okay, I'm on one. Okay, if you take the main resistance train, you'll just get, I mean, completely huge. Okay, completely huge. So we have to consider that when we are sort of talking about what do people look like, how big can they get, how strong can they get, et cetera, et cetera. Miles.
What about testosterone replacement therapy, like your stages, your natural testosterone production declines? Are there any studies on like the long-term replacement?
So, fabulous question. I can't remember if I have the slide in here about that or if it's only in my graph file. So his question is, all right, guys, you remember a couple of weeks ago I told you all you'd already peaked, right? Okay, you're already past peak testosterone levels. Just wait. Okay, I am screaming towards andropause at an alarming rate. Okay, at an alarming rate. Okay. Men go through what's called andropause, but it's a natural decline in testosterone that mimics time-wise sort of menopause in women, where estrogen and progesterone levels are going to change. Okay, and so as part of that, it leads to a decline in muscle mass. Sarcopenia is somewhat driven by this natural decline over time in sort of androgens. It's also driven by that you get older and you have kids and other things and you stop having time to exercise. Okay. But so the question was, what if, and this is a thing now, right? Go to pretty much any strip mall anywhere, and there's an aging clinic or male enhancement clinic, right? You can online, you can order testosterone, you can order all sorts of things. Okay. So the question is, have they done studies on men who are naturally declining? If we give them a replacement, then are there positive outcomes in that way? And so the short answer is on replacement for andropause, there's not a lot of data. We don't have a lot on that, mostly because what they're trying to do when they give you a replacement is to match it back to regular levels, to kind of whatever your normal physiological levels are. And they really sort of undershoot to start with those things. So we do know that it does seem to prevent some future loss, but it doesn't seem to have ginormous effects. A little bit of data that I have seen on dramatically enhancing the positive effects of resistance training. You just kind of are able to prolong what you guys would get right now. If that makes sense, right? Okay. We don't generally do hormone replacement in women as much as they used to. My mom took them when she was going through menopause, then they figured out that it increases your chances of some kinds of cancer. So she got off of them and then complained, was like, I want the drugs back, I'm tired of hot flashes and all of these things. And so I will imagine a scenario where by the time most of you guys are my age or old enough to go through menopause and andropause, that we will have figured out a better way to try to do some level of hormone replacement that can hopefully prevent some of the side effects of those things, and also don't come with the increased risk of cancer. androgens, especially testosterone, cause tissue growth. So they will cause cancer. They will cause growth of tissue. We replace estrogen in women. It does do tissue growth, but it has some particularly kind of potentially negative consequences on breast cancer, uterine cancer, and endometrial, those kinds of things. Those tissues that are particularly sensitive to those hormones. And so it's an interesting thing. Okay, but that's what we know. Okay. Like I showed you guys on Wednesday, when I say the vast majority of people can get 5 to 40%, here we are back to that study, bicep curls, okay? Almost 600 people. We have men, we have women, they're getting relatively equal hypertrophy. This is the percent change in cross-sectional area of the bicep, measured by an MRI, okay? This is as accurate as it could ever possibly be measured, okay? And what you will see is, right, there are some people whose muscle got smaller, very small number. The vast majority of people are right here in the middle, about 10 to 20%. You've got a pretty significant portion at 5. Most of them are going to get out here at about 30 or 35. You've got a few people that get really, really big. But no one getting more than about 55 to 60% increase in muscle mass. Okay? So, now you can argue, is this the bicep? Do you use your biceps a little more than some other muscles in your everyday life? Are they already sort of shifted a little bit towards their maximum? Maybe. Okay? Maybe. The evidence that we have is that the muscles in your body you use the least probably have the largest potential to grow. The muscles you use the most often in your everyday life, okay? Think your diaphragm, okay? Or your postural muscles like your calves probably have the least potential to grow, okay? They may grow some, but you use them, you tax them, you overload them just by doing everyday things, okay? So here's where we are. So if you get a friend who all of a sudden adds 20, 25, 30 pounds of muscle and does not have a corresponding increase in sort of adipose tissue and other things, they start looking to relieve, they're taking steroids. I'm just telling you they're taking steroids. Okay? Just what they're doing. Use is significantly more prominent in people that are y'all's age than I think people think. We had a capstone group that did a survey a few years ago. And the results were pretty fascinating. And maybe there was some bias in who responded, but it was in there. And we were at in men, college-age men that responded, about 15% of them said they were taking steroids. Okay, which is more than what we thought. So by doing all of that, we can look around at how many guys we have in the room. I don't know. We have 15 of y'all here today. We're probably pretty close. Then it would tell us that maybe 1 or 2 of you guys. There was some use in women as well, not as much. That's a fascinating sociological and psychological question about why is that going to be the case on those things. But it's out there. So just things you guys are going to see and going to interact with every day. Okay. So to me, in some ways, great. You work out, your muscles get bigger. They get about this much bigger. That's cool. We understand that. We know that. The fun part is why. Why? Why is doing squats that are heavy, what makes my legs get bigger? Why is that the adaptive process that occurs? Okay. And so we do not fully understand everything about it. We have a pretty good sense. And so we're going to talk a little bit about what do we think the signals are, okay, that lead to the activation of these protein synthetic pathways. The pathway is pretty well described. We know the genes that get turned on. We know the intermediate signaling molecules pretty well, but we still don't fully understand what exactly it is about the squat, okay, or what is happening that initiates all of that. So I'll talk to you about some of the things we think is going on, okay? To understand hypertrophy, we have to understand this process that's called protein synthesis, okay? Protein synthesis. I was a biology major as an undergrad. I think I had protein synthesis in every class. Okay, you guys have probably had it a couple of times. We're not going to go into all depth of those things, right? But you have genes in the nuclei of all of your cells. They code for the proteins that are in your muscles, right? We need to open that DNA up, make RNA, right, that correspond to those genes. Those RNA, those messenger RNA, then go to a ribosome. They get hooked up with ribosomal RNA. The ribosome then grabs amino acids and it assembles those proteins, and then those proteins go to where we want them to go. Okay? So to make your muscles bigger, we have to activate the genes in the nuclei of those muscle cells that say make actin and myosin, and make titin and other things that are going to go into making the sarcomere. Okay? This is a very complex pathway. There are many signals that are integrated together. They're going to play a role there. Okay? And I'm going to tell you guys one thing today, and then try to illustrate it a little bit better when we finish up stuff on Monday. Okay? Anybody in your bag have any protein powder? And if so, does that protein powder have some sort of an advertisement on it about this increases net protein synthesis by X amount or Y amount or something on there? Okay. If you take protein powder, when you get home, whenever you see it, look and see if it says something on it. Okay. So there's a thing that we have to appreciate about protein synthesis that makes understanding the hypertrophic mechanisms a little bit complicated. Okay. The first one is this. Okay. I'm going to do some squats today. All right. I'm doing some squats. Great. If you follow what is happening to protein synthesis in my quads for, say, the next 8 to 24 hours, okay, what you will likely notice is a relatively large increase in protein synthesis in those muscles, okay? 50%, 100%, 200% increase in protein synthesis. It peaks in about 24 to 48 hours, depending upon a few factors, and then it goes back down to normal, okay? Well, you gotta wait and have a rest day. You get it, it peaks, it comes back down, now go again, so you can make it go back up again. Okay? That response, that acute response, is giant. And then you measure someone over 12 weeks of training and their muscles got not 200% bigger, but 10%. Okay? And so what the protein powder companies do, what the workout companies, people will do, is they'll advertise based upon the initial sort of acute response. Be like 200% increase in protein synthesis. And that's not a lot, but it's a little bit misleading. Okay? And so what we know is there's some uncoupling of that acute response that is massive and can be enhanced by taking protein powder and eating some carbohydrates, or screw that, just drink chocolate milk, because it's the exact right balance of protein and carbs to maximally stimulate this, right? There's a window of time after you worked out when you can maximize that acute response by taking protein. It's anabolic window, if you will. Okay? But most of it doesn't play much of a role in the actual response that we get. And we'll talk about the why of that on Monday. Okay? Have a good weekend. Make good choices. Happy Valentine's Day if you celebrate. If you don't want to correct your test, give it back to me. Watch on Canvas for the course assessment. Okay? Thanks, guys.
course. For the Jeffrey, is actually added